first of all, I'd like to just thank everybody for all the interest that we've had to see Dr. Hanson come on and Peng Her. We're going to get to them in 1 second. We're going to let some people jump on. Before I do that, just two quick announcements. I want to let you guys know two important things. We lost a group member this week. Not only a group member, but someone very important to the group who saw it on from the beginning when it started 5 months ago. And it was a very, very tough loss. Her name was Jessica Hausum. And Darla, a group member in our Heal Mind, Body, and Soul community, talked about how we could remember her by doing a mentorship program. And I thought that was a great idea. So what we're going to do is, if you guys have, if you're having trouble from chronic pain, addiction, anything, we want to be able to find you someone that you can relate with inside of the group to talk to if you're struggling, you need help with anything. We want to remember Jessica and the great things that she did for the group, and remember her as a person who, honestly, when this group first started, she was one of the original people to start posting, to start asking people to come in. So please take a second to just, help her and her family. And just a tough loss. So I'm sorry to start the show in a bad way. And then the other announcement, I want to let you guys know that it is my mom's birthday today, and my mom's no longer with us, but she's with us. And so every April 15th, I like to do something special. And today we got some special guests, and I'm excited to bring them in. I see more and more people jumping on. And if you guys have any questions or concerns for Dr. Hanson or Peng throughout the show, feel free to, type a question in, and we will get all of those questions answered. So without further ado, first we have Dr. Ronald Hanson. Thank you so much for joining the show.
Good evening, Chris. Thanks for having me.
Yeah, no problem. Dr. Hanson is one of the top regenerative medicine doctors in the country. He runs his own clinic in Richfield, Minnesota, called OrthoCare Clinic. Dr. Hanson is a wonderful human being, but more than that, he has dedicated his practice to helping fluoroquinolone patients. And I'm sure you could tell us more on how you do it and what what your protocol is, but I'm just excited to have you on because I know that the amount of dedication that it takes to help us, right? We are damaged. We demand a lot. So thank you so much. And Dr. Hanson is also going to be running the second annual fluoroquinolone toxicity summit in August, which is again up in Richfield, Minnesota. So everybody, mark your calendars for that. Dr. Hanson also builds a team around him, and I know he's going to attest for his team and their expertise. And he brought a team member on today, Peng Her. And Peng, thank you so much for joining the show. And I got to say that you get such a cool name, and I get Chris. I don't know how that worked out, but thank you. Thanks for coming on. And Peng is into intuitive medicine, which I'm very excited to learn more about. He's an acupuncturist, a highly trained acupuncturist, big into Qigong, martial arts, meditation, and we're going to talk about how trauma can affect the body today and so much more with Peng. So hello, guys. Thank you so much for coming to the show, and thank you for being on.
Thanks, Chris.
No problem. So as I said, if you guys have any questions throughout the show, feel free to ask. I got my comments loaded here. Well, let's start. We're going to kind of divide this show into two parts. We're going to have the aspect of, how stem cells can help us, how PRP injections, what we can do to heal our bodies. And then we want to talk about how we can heal our minds, our souls, and get back onto that journey. And I know these things kind of intertwine with each other, as we talked about. But Dr. Hanson, what, when a patient comes to see you, what is the first steps that they're going to go through to see if they need a stem cell therapy or a PRP injection? What is that process like?
Well, we're doing this a little backwards, as we were talking earlier. I've learned over finally 13 years, because I'm a slow learner, that we need to actually start the other direction with the energetic, emotional, mind, body, heart part of the spectrum. Because if we don't get those things going, the body is not going to respond. And I say I'm a slow learning because it did take me about 10 to 12 years before I really was incorporating that a lot into what I did. And now it's really hard to do what I do without doing that. Now, let's just assume for a second that we've addressed all those pieces with somebody and
Sure.
they're working deeply on themselves and in the energetic, emotional, physiologic sides of the spectrum. I've learned to split fluoroquinolone toxicity into 4 groups. The ones that are collagen degradation dominant, neurologically dominant, mitochondrial dominant, and DNA dominant. Now, the 4th one is a little bit of a fudge right now because that affects everything, and it's really hard to track whether DNA damages the underlying concern. We're going to assume it is, given Jerzy Truskowski's research, that it does affect everybody. Luckily, we've got a little bit of a consortium, about 4 or 5 of us around the country, who are trying to put together the protocols, given Patricia Kane's information on how we can actually clean the DNA adduct piece of it, which is not a stem cell function.
Okay.
But I'd say from a physiologic standpoint, that piece of the equation is being put into the equation, or being given legs right now.
Sure.
But the mitochondrial, the nerve, and the collagen-based pieces all have implications in the regenerative medicine realm. And I always look at it from the perspective of what site are we working on, i.e. where are the symptoms coming from, but even more important to the symptoms, where is the degradation coming from, i.e. the first upper couple cervical segments are different than, say the sacroiliac joint, on how
Sure.
I'm going to treat those things, because they act differently depending on whether or not they're symptomatic and how bad their degradation is. So it's what site is it, how bad is the condition, and what other conditions or comorbidities are going on. Fluoroquinolone toxicity, because of, we all know the magnesium being, sucked out directly, and the direct damage to the tissue that happens from superoxide, all that stuff. We all know that happens. Why it happens specifically in some areas more than others, we're not exactly sure. But we need to assume that it potentially happened throughout the entire body.
Yeah.
So if somebody hurts somewhere, it's either right from that site, or because of a stress or strain pattern, or a neurologic pattern. I've learned to, as most people know, I've learned to spread this out into 2 parts of the body. I used to do very, very extended procedures on people, where I was trying to treat everything all at once because I didn't want people to have to come to me twice. And I learned over time that I needed to split the body into 2, because neurologically the body can't meaningfully incorporate all that information and have even a reasonable course after the procedures. In general, I've learned with fluoroquinolone toxicity patients that I'm always going to treat underlying neurologic problems. I have a very well-known fluoxy from Colorado who taught me that in the year 2010, 2011. And it's been part of what I do ever since then. I have an entire protocol for complex regional pain syndrome that I basically adopted in to fluoroquinolone toxicity. And that, for the most part, always needs a cellular source.
Sure.
Nerves are very tweaky, they're unpredictable, and they respond much, much better to cellular sources than they do just platelet-rich plasma or its derivations.
Okay.
So I've gotten to the point where I say pretty much fluoroquinolone toxicity, unless you're just very, very young and very, very mild, I'm generally always going to be using some cellular source. And in here, that means that's going to come from bone marrow, adipose, vascular tissue, synovial tissue, osteogenic sources, or blood, and more than likely all of them. 3 of those, I don't know of anybody else in the country that does them. I've had the amazing fortune of being inspired to create many, many things, and a lot of it's because of you guys. I'm blaming you for that.
Hey,
You're
don't blame
that
me.
complex and you're that challenging
Yeah.
that I just kept setting the intention to try to be as much as I possibly could be for everybody, and I just kept getting these downloads and inspired with different things to do.
Yeah.
So
So let me ask you, not to cut you off there, with those
You're going
different
to need to do that from time to time, Chris, because if you put a
yeah.
quarter in, I just keep going.
No, that's fine. So with that, with the nerve damage or the collagen damage, do you find different parts, like you said, the bone marrow, different parts that you're pulling these stems from? uh, what do you find the most productive for people? So, like, is it okay? You're suffering nerve damage, so I'm going to get bone marrow stems. Your Achilles tendons are gone. I mean, how do you decipher, or is it just person to person?
It's so individualized. It's really, really hard to say. That's why I say if there's an underlying neurologic cause, and I'm going to almost always presume that there is some neurologic underlying cause, the vascular and or adipose derived, a very specific fraction of adipose derived cells are the best for that.
Okay.
And for collagen itself, I this is going to get a little bit esoteric, but I'm going to say that it depends a lot on what you see on an MRI or an ultrasound. If I'm going into a disc, I always use a cellular source, and that can be any of the cellular sources. If I'm going into joints, I typically want a cellular source. If there's any arthritis at all, meniscus, fibrocartilage. If I'm just dealing with ligaments and mildly deteriorated tendons, PRP works great for that if you know how to do the procedures. So there's not just what am I using, it's how am I
Sure.
using it.
Sure. I got a tons of questions for that, but I do want to get to this one. Ingrid, a group member of ours, has a question where she says, and again, guys, if you have a question, I'll try to ask Dr. Hanson or Peng right here so they can answer it for you. She said that she got stem cells. She got placenta stem cells, and she showed a lot of improvement. And then 11 or 12 weeks out, she's almost back to where she was. She wants to know if there's any perspective that you have on this or why it would maybe reverse over time.
Okay, I'm going to try to contain myself. uh, I'm not a fan in any way, shape, or form of any allogeneic products, anything that comes from somebody else. I give whole hour to 2 hour long lectures on these kinds of subjects. And number one, all of the tissue is dead. You're putting dead cells in. That's been proven in now 3 different studies. And that's actually probably a good thing because you don't want somebody else's live cells in you, given the immunologic reactions that can happen. Now, this is where it gets fine details kind of down the road. You need to understand that um, what a company will say to you that uses umbilical type products will say, well, the cells are immunoprivileged. Your body doesn't reject them. Well, that's true if it stays a stem cell. But once a stem cell gets to a tissue, it starts to read the tissue and starts to differentiate and become what it needs to help that tissue. That's called differentiation.
Gotcha.
And in that differentiation process, it begins to exhibit cell surface proteins. And those are the proteins that come from its nuclear DNA, which was its donor or its source, not the person. Then you have an immunologic reaction. What happens is, for the most part, B lymphocytes, and this happens in the lungs too when you do an IV administration, the B lymphocytes come and they eat the cells. They take their cell surface markers and receptors and put them on their surface. This is Arthur Kaplan's research, by the way, that came out about a year ago. He's the father of stem cells. Eats those cells, takes the receptors, put them on the surface, and then they go find T cells, which are another kind of immune system cell, and activate them to become T regulatory cells, which help the immune system for weeks to months. So a symptomatic response from a placental or umbilical source that lasts, anywhere from like 2 to 6 or even 10 months is not uncommon. But that's my rule number 2 is, to some degree, and this is being a little flippant, I don't care if you feel better.
Sure.
I don't want you to feel better. I want you to heal.
Yep.
And healing might hurt worse at first than something else. But healing is going to get to the root causes of why you have problems, and it's going to ultimately lead to reorganization and meaningful change and transformation of the underlying factors. And that's a process. That process takes 4 to 12 months. And anybody telling you that they're going to make you feel better a lot quicker than that is doing something that's helping you feel better, not heal.
They're masking the problem instead of healing the problem.
Yes,
So
very, very different concepts.
yes, yes. So Peng, let's bring you in here. Thank you for waiting patiently. Peng, so when did you get into intuitive medicine, and can you describe how that goes along with someone suffering from chronic pain or fluoroquinolone toxicity? How can intuitive medicine come in and kind of help those symptoms, kind of either calm those symptoms or help us heal from those symptoms? And is it something like desensitizing our bodies so that our brain is not, picking up those, those signals? Is that kind of what intuitive medicine is, or am I just way off on this?
Desensitizing is more kind of like a opioid approach, and
Sure.
that's not really the approach. So intuitive medicine. So for me, um, some of this stuff are, these are trigger words for me, but yeah,
Well, that's what I wanted to do.
the idea is that because when it comes to intuitive medicine, it really depends. The skill level depends from one individual to the next. And when it comes to intuitive medicine, it's really about the individual having done the self-work, done the personal transformation, done the personal transcendence, and working through their own traumas, and having the ability to have some clarity into really kind of healing themselves before they're able to heal others. And so through this self-work, through the martial arts, the qigong, the meditation, I've been really working on myself from a sort of a personal transformation and also a spiritual standpoint, that it allowed me to tap into this sort of inner knowing that we all have. It's a spidey sense that we all have, just a gut feeling that we all get. And women tend to get it more so than anybody else, more than men. And when people ask me, what does intuition feel like? I always ask the women in the group, I said, well, do you know that creepy guy radar that you got? and they all kind of chuckle. And I was like, yeah, exactly. Try to explain that to men.
Yeah.
And so there is that intuitive sensation, that spidey sense that we have all within us. And as you begin to peel away your traumas, your hurts, and you begin to really work on your own personal transformation, then that's when that intuition starts to show up. And the thing is, it's there. It's always there. We just haven't. We're too busy in our head. We're over analyzing, over calculating, and we dismiss this inner voice that's constantly speaking to us. So, one of the things that I found out recently is that Socrates calls it the daemon. I hope I'm pronouncing that correctly. The daemon, and it's basically an inner voice that he consults before he makes decisions. And this is the voice that you are speaking to, with yourself in the morning, every morning, and kind of throughout the day. And so the idea is that really learning how to tune in and listen to that inner voice and have a dialogue with that inner voice. And again, within the mind, there are multiple voices. But once you start once you start healing and getting rid of certain faculties of the mind that are more negative, the negative self-talk, and these things, and this is the thing that lots of the, I hate to say it, guys, but a lot of the floxies have lots of negative self-talk. And until you defeat those demons within the mind, until you defeat those voices, you aren't really able to hear this voice. So positive self-talk is going to be a very powerful tool into you and on your healing journey. And I'm saying with Dr. Hanson here, you punch a quarter and I keep going too. So
that's good. The more information that you guys can give us, the better, and I agree with that positive self-talk. It's almost, I don't know if you're familiar with central sensitization, but it kind of seems like it's touches along that path of like you're sending, like every part of your body has sensations that send signals to your brain, pain signals, different signals to your brain that it sensitizes it. So you're actually feeling pain when you're not actually in pain. So it kind of sounds like intuitive medicine kind of goes with I know you don't like the phrase desensitizing the body, but it does
Right,
kind
right.
of sound familiar in that aspect. So let me ask you this. When someone comes and sees, a Floxy comes and sees Dr. Hanson, are you seeing them day one?
It depends on the patient. It depends
Okay.
on the patient, and so, but usually we have for Heart Day, we'd like to encourage for Heart Day we encourage coming to see for stellate block, and then also coming to see me afterwards for acupuncture. And I
Got it.
think Dr. Hanson kind of better explained that better than me. But as far as intuitive medicine is concerned, it's really when I look at individuals, there's sort of this inner knowing as far as to what's going on inside the body and what type of emotions are there and what needs to be released. And once they come and see me for acupuncture, I insert needles into different parts of the body where I see there is obstruction in the body, and then I also touch the body, and then also kind of sort of send in my mind, communicate with the body, and try to get the body to remember what it was like prior to the injuries, prior to the trauma.
It's very important.
The we're all designed we're designed by nature to be in a fearful state, and also to collect data in regards to things that create fear within us in order for us to remember those things, and also to develop a hypervigilance to observe them, and then also learn to look out for them. And
Sure.
the thing with a lot of the Flox patients is that there's lots of hypervigilance, and it's just an observation, and I hate to generalize, but what I notice is that there's lots of hypervigilance, and you're constantly looking for things, and by doing that, you're putting yourself into this fight or flight state of being.
Yeah.
And until
It
you
is,
can,
it is tough because I do think it messes with our neurotransmitters a lot. So yeah, we're in that fight or flight mode constantly because, one thing, we wake up, the next day it's another thing. And then, it's tough to turn that off. Right. So turning that off is definitely key. And, we do have another question, Dr. Hanson, from Cameron. He would like to know why some people get reactions to fluoroquinolones instantly, and why some people have delayed reactions months to years later.
We don't know yet, Cameron. It's going to come down to underlying physiologic state, previous injuries, and genetics. And if you have the internal physiologic pathways and enzymatic pathways inside the mitochondria and nuclear DNA repair medicines and things like that are not good. You got one bad one from one parent, one good one, or two bad ones from each of your parents, like MTHFR and all the different kinds of enzymes that we have that are keeping us going all the time. You're going to be more susceptible. That's one of the talks that is given at the Fluoroquinolone Summit is who is, in retrospect, who might be susceptible. And I believe Charlie Bennett is going to be giving a lot of that talk because he's developed a way to try to screen people. So that'll be part of that summit. So hopefully we're going to eventually get down to the point where before anybody's ever given a fluoroquinolone, there's a test that we can say, okay, no, this person should never get a fluoroquinolone.
Sure.
That's the ideal. I'm not as much on that side of the or that side of everything because I don't. That's not where my brains are best used. But I advocate for that a ton, and I'm hoping that we eventually go the way of like the EMA, where it's these medications are used extremely conservatively, if at all.
And I love that about you guys, that you can say, well, that's not my expertise, instead of giving some, excuse my language, but some bullshit answer that is just to, make you sound smarter. So I love that you follow your expertise. And we got another question from Shirley, who's has permanent nerve damage. Seems like she struggled for 5 years from it. She says, is there any way to regenerate the nerves or for the nerves to come back?
Well, Shirley, I'm going to tell you there's a patient that everybody should thank from about 7 years ago. Her name was Jen. She had a nerve injury. It happened to be a traumatic nerve injury that I was working on. And at the time I was using a needle and kind of going around a nerve and opening it up and using growth factors around it to try to stimulate it. I got like 1/4 of a millimeter off the tip of my needle, and the needle ended up going into the nerve, and the whole nerve swelled up while I was injecting it. I thought I just destroyed this woman's nerve, and I said, you know what, call me and let me know how everything's going. I might have injured you badly. She called me up the next morning and said, hey, I can lift my hand up. I haven't been able to do that for 7 months.
Oh, wow.
Hence was born the treatment of intraneural injections. And that's one of 6 sites in the neurologic system that we work on. The other 6 or the other 5 are superficial neurologic abnormalities. That's typically treated with what we call neuroprolotherapy. That was started by a doc in New Zealand. Then up from the peripheral nerve is the compound peripheral nerve, the brachial plexus, the sciatic nerve, the femoral nerve, the very big nerves of the body. Back from that are the nerve roots that come out of the spine. Adjacent to the spine are the sympathetic nerves, the sympathetic chain. Those are coordination areas that deal with your fight or flight nervous system in the body. And then, of course, there's the central nervous system, which is brain and spinal cord. And the protocol, if I can do a protocol, I'm not very good at doing protocols because everything is variable per patient that I'm working on. Is to work on all 6 of those levels of the neurologic system, because even though an injury might have been in one place, the neurologic system is more or less your electrical system, and it's going to travel. And what happened in a peripheral nerve can actually start affecting the central nervous system. Anything happening in a peripheral nerve is going to have sympathetic abnormalities involved in the situation, and then anything down from where that injury happened is going to be affected. So even though the ball might have started, or the line of dominoes might have gotten pushed in one spot, it's a special domino where you hit it, it can actually split and go both ways, down the nerve and up the nerve, and cause abnormalities. So finding under ultrasound and really careful physical examination is the best way to know how many and how assertively and how carefully and how completely do I need to treat all of these areas. It's the most elegant area of the body that I work on is the nervous system. And be very, very careful with it, and very, very appropriate with it.
Well, I was going to ask you that too, because I know when I called you a little while back, and one of my, things was, well, I'm fearful. I'm fearful of coming in and getting, injections into my neck and by my spine. And so I know that I'd like you to touch on your guided approach with it and how safety measures come in, because I know a lot more people might want to come see you, but the fear of having stems pulled out of their bone marrows and injected in close to their spine, like how do you balance those fears along with what people need?
I do this. I have 4 forms of guidance that I use. Ultrasound, which is best for soft tissue, especially the more superficial soft tissues. You can see everything that you're doing very, very well. Like the intraneural injections that were developed, that myself and one other individual in the country pretty much developed how that's done in 2012, 13.
Okay.
Second is fluoroscopy. So that's typically bone-guided injection. So anything that we're doing around the spine really needs fluoroscopy because just ultrasound is not quite there. I mean, when I'm getting into the joint that goes between the head and the neck, I can get there with ultrasound pretty close, but I don't know if it's flowing appropriately as it should inside the joint unless I look under fluoroscopy.
Okay.
So after that, then there are very specific areas I'll use arthroscopy, which is like a needle-sized, 18-gauge needle-sized camera that I can put right in the spot to look at it with real visualization. And then if I can be a little bit out of left field, I have a 4th form of visualization. When I'm there, when I'm feeling where my needle is, what's happening in that site, There's a sixth sense that occurs that I can't quite describe. But if I'm feeling a tissue and it feels like this kind of texture or that kind of texture, I do different things with the tissue every time I'm in a place, every time I put a needle into somebody.
Okay.
And that's sixth sense or inspirational guided or intuitive guided types of treatments for someone. And that's something I didn't develop until a few years ago. Again, I'm slow, and it took me a long time to figure out that, I'm not thinking about this. I'm feeling what's happening.
Mm-hmm.
And that was a layer of treatment that I haven't been able to teach to anybody. It's just come spontaneously with time. And when I've gotten my brain out of the way and let my feeling and finer sensations guide part of that process.
Okay. So I'm trying to keep up with all these comments. I'm sorry if these questions are bouncing around, but
Okay, I'll be quicker.
No, it's fine. Amy wants to know: do you use dyes with the fluoroscopy?
Yes, I use OmniPake. Is not the one which that collects in the brain. Everybody's really worried about that particular one. I've used this on Floxies for 10 years, and I haven't had anybody overtly respond negatively to it. I use it at the like lowest concentration I possibly can, and I actually put growth factors from the PRP in with it, so that if it is causing some local irritation, it's being offset by the platelet lysate being there with it.
Okay.
I think that's unique. I don't know if anybody else that does that in the country.
Okay. Yeah, that makes a lot of sense. Cameron's asking if steroid injections are safe. I could probably answer that one and tell
Go
you.
ahead.
No, Cameron, don't go down that route. Trust me, I went down that route. Michael's asking, how is the brain able to repair or detox? In my head, and it's burning in my brain. And what do you do for muscle loss?
Okay, so muscles you got to think of as the puppet. They have no intrinsic function whatsoever without nerves. So they are the final extension of a nerve. So your nervous system is actually the actual structures that are being communicating via muscles. So if it's a muscle issue, it's a nerve issue. And that's a long discussion on how nerves can all affect muscles, but it's a nerve issue. And then finding what level of nerve issue it is the important part for treating muscle. For getting to the brain, there's 3 ways to get there. I employ 2 of them very regularly. One is the intranasal route. Yes, you get to snort stem cells.
Can I ask you real quick with that? Does that help with the eyes? A lot of Floxies have vision issues and pain around the eyes. Would that help with that?
The pain, I'm not sure about the pain one. I just had somebody here recently where I tried something new on them with the eye pain piece of it. I'll let you know how that turns out. That we think that's probably an equivalent of the extraocular muscles that that are moving the eyeball, probably like the equivalent of myalgia or spasm in those muscles, which would again be a neurologic issue. And those are cranial nerves that you're dealing with. There's no way to directly get to those. But indirectly, nasal application, ask any cocaine addict, the best way to get a high is to snort it, because it goes through your nasal plexus of vessels right to your brain. And the blood-brain barrier can actually be accessed by stem cells. So stem cells can go through there. They have the right key to get through the lock, which is extraordinarily important. Putting directly into cerebrospinal fluid or by intrathecal route, these regenerative agents that the brain has never seen before is extremely dangerous. So I have a very specific slurry and cocktail of things that I put directly into the cerebrospinal fluid via a lumbar puncture or spinal tap.
I got to repeat what you just said there. So stem cells actually are known to cross the blood-brain barrier?
Yep.
Wow. I did not know that. That is awesome. That could be huge for a lot of Floxies then.
The third way to get to the brain directly, and I haven't done this yet, but somebody else actually did the research in 2017. You could take a very, very small needle and go directly into the carotid artery and inject there, because then again, you're going to the blood-brain barrier, and you get stem cells have the key to get in. That one I would definitely have an IRB approved study to do if I was ever going to do that.
Okay. Wow. Good to know. Good to know. We have a question from Carrie. She says, if you lose sensation in your hands, can it come back?
So I'm of the thought pattern that everything can come back. And we got a lot of neurologic questions. I want to introduce two topics to everybody as I answer this, okay? There's something that I realized just a few months ago. There are these 6 levels of dysfunctions that can happen in the neurologic system. And what happens is, and it took me forever to realize this, that there are superficial kinds of abnormalities that happen. You feel them in your skin. You feel them, in the muscles and the fascia, sometimes where tendons insert into bones. Those are neurologic abnormalities, and the superficial side of them. And those 4 things I just mentioned, which is fascia, skin, the nerves, and the trigger points in the muscles, those all have individual treatments for each of them. And I do those 4 sites on day number 1. There's 3 procedure days, which you can see that full presentation of my 3 procedure day method on healing flaxseeds from fluoroquinolones, which is Jason Sousa's site. That's for the chronic pain people. That's where that is right now. And perhaps Chris, I can send that to you too if you want it.
That'd be great.
It was a webinar that I gave. It's just a PowerPoint format. But anyway, what ended up happening and what I realized is you have these superficial neurologic abnormalities, but you have deep ones as well. And the deep ones cause the superficial ones. And then the 2 fight against each other in the circular abnormality that happens back and forth. That's why those 4 treatments actually exist, because they circumvent and stop part of the process of this transduction of abnormal neurologic back and forth. And I do all that on day number 1 when we're doing stellate ganglion block, decreasing the sympathetic nervous system, and Peng is working his magic with the neurologic and energetic and emotional side of what he's doing. So we put all those together in 1 day, and that's the easy day. That's the small day.
Yeah. So Peng, how does, and I'm sorry, I didn't mean to cut you off, but I'd like to bring
go for it.
Peng, how does, acupuncture help the neurological system? And also if you could touch on one other thing for me. I know a lot of floxies have issues with their calves or Achilles tendons, being able to walk properly. Can acupuncture and things like that improve those symptoms as well?
So acupuncture can help improve those things as well. But again, like I really want to push mindset. And I think the only way for me to push that, I can't talk through it. I really have to just demo it.
Sure.
So maybe if I can take like maybe 3 minutes to kind of do a little exercise for folks to kind of, who are watching this, to actually get a felt sense for some of the things I'm talking about. Otherwise, it's just theory, and then theory is debatable.
I would love that. I was actually going to ask you to do that, but I didn't want to put you on the spot. So go ahead.
No, I'm game. That's the whole point of doing this. If we aren't able to demonstrate it, then it's just theoretical. So for me, I'm a show and tell kind of guy, and that's what I'm doing. So basically, what I want to do is for everybody who's watching, just take your palms, just kind of put them up in your lap, and then just breathe in the nose, breathe out mouth, and then you shift your mind to your hands. Okay, and just. Okay, and then real quick, we're gonna just like wash your hands like that. So everybody kind of wash your hands like that. And then I want you to kind of do this and does it feel kind of even? Okay. And I want you to take your left hand and I want you to say anger, 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 anger. All right. And I want you now to talk into your right hand. I want you to say happiness, 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 happiness. And I want you now to weigh the hands.
Oh,
Which
wow.
one's heavier?
Yeah,
Yeah, which one's heavier?
the left one.
Yeah, exactly. Now you wash. All right? And then you weigh again. You weigh again, see?
Yeah, back to even.
So the idea is that your thoughts, your intentions, the things that the words that you use, your language, all these things, they have weight. And when you get up and you're already frustrated, oh, I hate this, I don't like this, I don't. No. What you're doing is you're programming all of this, everything, your thoughts, your intentions, your emotions, all of these things. It's software that is training the hardware, which is the physical body. And so your mood, your emotions, all these things, they trigger a physiological change. So, you know, everybody knows when you've gone on a date and you meet this wonderful person and you're madly in love, you're getting up at 4:30 in the morning and everything tastes great. And then you can go to sleep at 2 in the morning and get back up in 4, you'll be fine. But the moment you break up with this person, everything goes downhill. Your physiology changes, your appetite plummets. And no matter where you go, you're not feeling good because there are these emotions that are you're constantly radiating these negative emotions. And this is critical in your healing process. So what acupuncture does is, acupuncture is wiping away the negative self-talk. And this is why when patients who are coming in, when they come in to get acupuncture from me, what I'm doing is I'm touching them and I'm reprogramming. I'm telling their body heal. And I'm reminding the body that, hey, remember what it's like prior to these traumas, prior to these injuries. And I'm bringing the mindset, not their mindset, but their body. I call it the body consciousness. I'm having internal conversation, dialogue with the body, and I'm bringing that body back to when it was resilient. And most of the time, it goes all the way back to childhood. And so this is why when I leave the room, most of the patients who are on the table, they start having very vivid visions about being back in their childhood and seeing themselves play soccer, kick the ball, climb up trees, climbing up ladders and doing just kind of mischief and whatnot. And the thing is that the body remembers it, but we have to make the body forget some of these hurts in order for the body to remember. And that requires daily effort. It requires discipline. And so if you want to talk about healing, this is healing. This is a critical role. That plays a critical role in your healing process.
And I honestly, I thank you for that because I can't explain how important that is. I was blessed, well, cursed and blessed to go to Mayo Clinic for 9 hours a day, 28 days straight, in which we learn those things: positive self-talk, cognitive behavioral therapy. And you know, over the 28 days I was there was about 45 or 50 of some of the worst pain sufferers in the world that came to this clinic. And we were not allowed to say the word pain for the 28 days. We could not say pain. We could not talk about it. We were retraining our brains, and we didn't talk about diet. We didn't talk about supplements. We learned about the pain receptors and basically everything that you're talking about. And I'll say that I saw all my friends, and they're on this page now, but I saw people who didn't take a step in 4 years stand up out of a wheelchair and start walking. I've seen the power of mindset. So please listen to what Peng is saying. It's more important than any supplement you'll take, or you know, it's going to go along with any procedure that you guys do. And what you said is the commitment that it takes. It's not just going to happen overnight. It is a commitment. I mean, it's a job. It is a job, but you can't think of it as work. But you know, the meditation, you know, I know a lot of floxies and chronic pain people like to take Epsom salt baths, right? And that's a good time where you guys can retrain your brain right there. So no, I thank you for what you just did, and the you know, the anger, the happiness, that it works.
Yep.
It works.
It's repeatable. Switch hands. Think about your feet. Like it's repeatable. And everybody's looking for the what, but this is the how, man. Like I really want to encourage the how, and the how is really here and really here. you have to think about your mindset. It's just like your diet. What you eat, whatever you consume, it becomes of you. And it's the same thing. If you are constantly watching the news, if you're constantly reading about negative things and constantly looking for negative signs, what you're doing is you're continuing to perpetuate and receive and also become a beacon of that negativity. And don't do that. Don't
Yeah.
don't consume nonsense. Like really start to consume positive things every
So
day.
yeah, so I guess for either one of you, whoever wants to answer this, but how did you guys team up and realize that this is a intricate part of healing? Dr. Hanson, I know you're laughing. How did this come about?
I have to give credit to Peng, so I'll let him tell the story.
It was wow, I don't know where to start, but I guess it was we met at a business networking group, and he came and talked about stem cells, and he was talking about using intuition for healing. And so then I approached him and said, hey, this is what I do too. And we kind of connected that way, and I got his number, and then we kind of reached out later on. And this was when I was looking for a new clinic location to keep my practice going and whatnot. And when we met up, it was just, this is divine intervention as far as I'm concerned, because and today we had a conversation about this today too. I said, man, I love you and I hate you. And it's really, I appreciate him so much because he embodies all of his strengths are my weaknesses.
And vice versa.
And vice versa. And he's embodying his strengths, and what he's embodying are the strengths that I'm aiming towards attaining. And it's wonderful to be around an individual who has those qualities, because it helps me level myself up. And when I see an exemplary individual in front of me, it sets a high standard, man. And that's why I said I hate him. So it's a love-hate relationship, because he's such an exemplary individual that when I see that and I see him walking around being that, I'm like, oh, I'm not there yet, man. And so all I do is every day I chisel away. And I think that, he and I can agree that we are getting closer and closer to becoming our complete selves. And I think that trying to surround yourself with individuals who are like-minded, like what you guys are doing here, Chris, which I really appreciate. It allows you to keep yourself in that mindset. And really, we pull from each other's strengths, and it helps make us better every day.
That's awesome. That's awesome. Yeah. And that's what you need, right? I mean, you need that yin and yang. So
yeah,
that's
definitely.
Good. That's good. So, all right. So let's say I'm looking to become a patient. I know you guys have both talked about this, a 3-day program, right? So could you walk us through this 3-day? And I do have to address one other thing too, because there are other people who are not Floxies on this group who are suffering with pain, whether from a car accident, shoulder surgery, whatever it is. Can those people also come in and see you guys? And how did you treat them? Is it still a 3-day protocol? And not to keep piling on the questions, but I'm also wondering what other symptoms, like, do stem cells, can you heal with stem cells? Like I've heard, people with MS or Parkinson's, or people who, have a torn shoulder. Like what is the range of people that could be helped from these procedures, I guess?
Well, first of all, Chris, I don't want to overspeak. I've been doing this for 13 years. I was one of the first 10 guys in the country doing it. And there pretty much is not a condition I have not worked on at some level. Fluoroquinolone toxicity itself, 13 different conditions went into creating what I do for fluoroquinolone toxicity, from Ehlers-Danlos syndrome to chronic pain to chronic neck to Achilles tendons to all the complex regional pain syndrome, on and on and on. I totaled it up one day and I'm like, whoa, there's a lot that went into this. So there's always a way, but being very slow, very careful, very thoughtful, and having a group of people to assess all of these individuals is critical. Now, those of you who have come to see me would see a chiropractor and a physical therapist, each of which have 30 plus years experience working with people, amazingly excellent, skilled, and selfless in their approach to working with somebody. That's towards the patient, where their ego isn't getting in the way, and towards collaborating with us as a group. That, I'm going to tell you, is the gas in the engine. We do what we do based on selflessly caring for other human beings. And you have 5 or 6 people that are all going to be doing that together. That I haven't seen replicated anywhere. I mean, you could have the world's best Ferrari sitting in front of you, but if you had no gas in the tank, it ain't going anywhere.
Yeah, yeah.
That's why I can put my protocol and all of my methods out there, because that's just the Ferrari. And if you just want to have all your buddies over and show them your Ferrari in your garage all day long, and that's all you want to do, that's fine. But me, I want to get that gas in the Ferrari, and I want to get that Ferrari to do everything it possibly can. And the 3-day protocol, it's very common for me to do that with people who are coming from distances, because I can't look at them and say, well, you're maybe a 2-day, you're maybe a 1-day, because I can't lay hands on somebody. I can't be in their presence. I can't feel them. I can't have the input from all the other people that work with me. So I make the least amount of money actually on a 3-day procedure. I did it that way so that it would be encouraging as much as possible for people to come and do it. It's 7 different tissues, 16 different concentrate, and 32 different combinations of things that I'm putting in different places in the body. Usually with somewhere between 50 and 80 microsurgical procedures. I don't do injections anymore. I do microsurgical procedures.
Okay.
When I get there, I'm actually working and opening or bringing together tissue. It's not just poke, done, inject, done. I mean, that's what I was doing 12 or 13 years ago, but not now. So yes, very, very wide range of things that we work on. And if I can do fluoroquinolone toxicity, I can do pretty much anything. It is the most complex condition that I work on. But I'm very upfront with people. If they say, well, have you done this? Have you done this? Have you done this in a female between age 32 and 34 who's had symptoms for 6 months and did well with magnesium?
Yeah, yeah.
I probably have somebody like that.
Could I ask you, because I brought up my mom earlier, being her birthday, and what she actually struggled with was COPD.
Yep.
The COPD help stems, and actually someone I know watching right now is wondering that too.
So I don't personally do that.
Okay.
I do. The doc who started that actually is down in Florida, and I've got to meet him a lot. He was an ICU doc, and he was actually drawing people's cells, sending them to Israel, getting them culture expanded, and then injecting them in one of the Caribbean islands. Which one was it? The one that's on the other side of Haiti, Dominican.
Okay. Yep.
And that was way back. I mean, 12 years ago that he was doing that. And these were culture expanded autologous cells that were then being placed under, he was an interventionalist, and he would do angiograms and get the cells, the catheter right next to where he wanted it to go to, get it up into the brain, to the heart, to the lungs, and place them that way. Now, there's a lot of purported, treatments out there. I just do one $10,000 umbilical cell treatment, and your COPD is going to get lots and lots and lots better. I hope you have a lot of extra pocket change.
Sure.
No studies out there, and I told you what it does to actually do an IV infusion of umbilical cells. That being said, you're going to feel better with more T regulatory cells in you. I haven't known anybody that died that had that procedure, so I guess you got that going in your favor.
That's always nice. So let's jump into the fluoroquinolone conference then. That's coming up in August, right? August 15th, I believe you
15,
said.
16. Yep.
Awesome. So explain, this is the second annual conference. Are you looking to do this every year, and what exciting guests you got coming, and just tell us a little bit more about it.
Planning on it being a yearly event, and what we've been doing since in the last 6 months is trying to form up 2 sets of information. Number one, how do you assess somebody who has fluoroquinolone toxicity, which, by the way, is a historical diagnosis. There's no test for it. But how many of you who are flocks said, I took 5 pills of this and then I felt terrible and I was fine the rest of my life before that?
Yep.
So there's that. How do you assess somebody from the physical therapy, the chiropractic, the psychoenergetic healing, the functional medicine side, personal training, and regenerative injections? How do you assess them? What are like, you have to do these are a good idea, and in special cases do these. And what we're trying to create is a logical approach to how you look at somebody. And then a separate section, which is going to be, these are the treatments, and again, level 1, level 2, level 3 sort of approach to that. So far, we've got confirmations from myself nationally. Dr. Mark Harris, who's really well known, incredibly intelligent guy. I had an amazing conversation with him. I'm just going to say that.
Yeah, great.
Very selfless individual who's very interested in other people healing. He's going to be doing mitochondrial aspects of disorders. Jerzy Derskowski is going to be there for the DNA aspect of it, and the two of them will overlap a little bit because there's DNA aspects of mitochondria. And let's see, Charlie Bennett will be there. He's going to, I think I'm going to have him do the Jay Cohen Memorial Lecture.
Okay.
He's going to talk about his test, and then updates on what he's trying to introduce to the FDA as far as warnings and changing, their way that they look at fluoroquinolones. Let's see, and then there is, I'm forgetting somebody. Who is it? No, nationally, I think that's probably all the national people. I've got a couple other feelers out to other individuals, but from the functional medicine side, we'll also have a general, like, these are the mechanisms of fluoroquinolone toxicity, what they're all doing physiologically in the body. That'll be done by Kathy Moore. She's a functional provider in the Twin Cities that works in our consortium. I'll be doing the regenerative injection side of it. Jonathan Waters is a personal trainer, smartest personal trainer I've ever known, actually. He was going between personal training and medical school, and he went with what he was like super interested in so that he didn't have to work. He kind of brings a lot of what we do together, and now that he's got all of his remote working protocols together for everybody, that'll be a reality for everybody to see him and then work into trying to create some degree of health wellness. As some of the symptoms decrease, we can actually increase physical capacity and physical ability and exercise. Carrie Collett is a dietitian. She'll be doing the MRT LEAP program and maybe some micronutrient analysis, like cellular analyses. Paul Nash is a chiropractor, been working with me for 5 years. Carrie's been working with me for 4 years. He's going to talk about the chiropractic approach, and not just chiropractic snap, crack, pop. It's chiropractic. Here's all of the things. He kind of bridges a lot into the functional medicine side of it too. Okay. And he'll have fun little toys like how to measure sympathetic responses in people, and how to measure, or how to use, like, shockwave therapy, which a lot of my patients have really loved him doing shockwave therapy on them. Dennis Wogan will be doing digital motion X-ray, which that's one of my underlying subspecialties, is working on that. Digital motion X-ray is an amazing imaging study that essentially tells me exactly what I need to do to help connect, stabilize, and heal.
Okay.
And let's see, have I forgotten anything? Well, Peng, of course, will be working on psychoenergetic healing, intuitive healing / acupuncture for everything. And there's going to be, I think, another approach, where we're going to talk about that a little more deeply, because it's become a big part of what we do, because it needs to. I'm going to suggest to everybody, before I forget again, the one book I tell everybody to get is Joe Dispenza's book, You Are the Placebo, which is a lot of what Chris was talking about with retraining the brain. In that realm of the world, Chris, what I tell people is when somebody feels a sensation that they usually associate with sadness, pain, to stop and thank the body for telling them that that's there.
Yeah.
That it's not, don't associate something bad with that. Be thankful for that. And then ask the body, what do you need me to do for you?
Okay.
Because if you start to think of something as bad and painful and terrible, your body doesn't understand the difference between that and there being like an injury or an infection there.
Yeah.
And it's going to go and start attacking it. And you can't win an internal civil war.
You cannot. All right, I don't want to keep you guys here too long, but I got a few more questions and then I'll let you guys go. You can rapid fire them if you want to, but I got 3 questions from the audience watching, and then I have one last personal question. So if you want to rapid fire these or however long you want to take on them, that's your call. But Darla's actually asking about that you've incorporated IVs into your protocol. Could you talk a little bit more about these IVs?
So, and there's new development that's happened in the last couple of days with that. So as I said, some of these protocols are going to come from Patricia Kane's work. There's a local functional provider who's extremely meticulous, very, very experienced. He did some of the lectures while I was in medical school in the late 90s on integrative medicine. And he's already up running and doing some of those protocols. So we may be sending everybody up there just for the DNA like cleansing part of the IV protocols. So that might happen a little faster than I thought it was going to. But everything is going to be based on what is the renal function, what's liver function, what our electrolytes look like, what does the micronutrient analysis look like on somebody. That's what are your nutrients, vitamins, minerals inside your cells. So we're not just doing, well, on day 1 we do this, day 3 we do this, day 5 we do this. We do this based on what are your actual needs from a nutrient standpoint. And we need to get those labs before somebody comes so that we can order what that person needs for IV treatments. There's no, set price like per day or per week or anything like that.
Yeah,
because nobody's going to get the same set of things.
And you guys might not have this worked out yet. I know it's a new protocol that you're currently adding, but as far as things like glutathione and different NAD, are you guys recommending that route, or?
That'll be a per person basis. So I got to be really, really careful on individuals that have had neurologic damage, of course. If those things are low in our testing, yeah, we want to do them, but people are here for 2 weeks, so do a quarter of a usual dose, see how they respond.
Okay.
Rather than giving them a full dose and send them on their way and have them be much worse.
I like that approach. All right. I hope I'm saying this right. Anayak wants to know, Dr. Hanson, do you have any experience with floxies who have benzo withdrawal?
So benzo withdrawal shouldn't be lasting too long. I'm not sure I'm not sure what he's looking for in terms of how I would assess that or what I would do differently than usual.
Yeah,
give him a minute to type in.
Yeah, I would assume that, any damage that you picked up on your, on the exams, you'd kind of treat the same way as no matter what the damage was from. Is that correct?
Yeah, I don't see where benzo withdrawal is gonna affect what I do typically. Usually I help sedate people with benzos. So if we're not using that, I'll probably use like oxytocin and oxygen and things like that to help sedate people while I'm doing procedures. I just wouldn't use benzo in that case.
Okay, and then my Uncle Steve is on here, and he has a question because he had radiation chemo, and he developed nerve damage in his feet that is spreading into his legs and hands.
Yep.
He is on gabapentin, which I've talked to him about that. But
Good.
Is it better to exercise, like to keep walking, even though the pain is horrific? That might be a question for you or Peng, I'm not sure, but whoever wants to answer it.
I'm going to say this. The neurologic system is the most tweaky part of our anatomy physiology. And that's partly because of the sympathetic or fight or flight nervous system. So you do your body and your symptoms no good if you try to push through something. Your neurologic system is just going to slap you. And the idea is if your function is here, come up to it, but don't go past it. And if you keep doing that, eventually your function is going to increase. But your sympathetic nervous system is sort of like a beaten dog. Once it's beaten, it's going to be shy to anybody reaching their hand out to it. You got to reach your hand out dozens and dozens of times with that dog being comfortable with you finally seeing it before it's going to trust you. That's the job of the sympathetic nervous system, is to protect you. So it's always going to be fearful. And
I love your
so
analogies.
come up to it, but don't push past it. I love deep water immersion, walking or jogging for radiation, and actually for any neurologic condition.
All right, awesome. And I hope all you guys got your questions in. I'm going to end you with one more that's very important to me, and a lot of Floxies who I talk with daily are struggling with this, is how the hell do we help our Achilles tendons? How are we able to, because can you actually, I don't think you can actually inject the Achilles tendon itself. Is that correct? And then,
Oh, sure you can.
Yeah?
Oh, yeah.
Oh, okay. Could you explain that? And have you had success with people who have been in wheelchairs or have, struggling to walk and because every step that I take, it feels like everything is about to rip. Like I lost 50 pounds in 2 months and my ability to walk, and I was taking 12 to 15,000 steps a day, and overnight this happened. So, and I know a lot of Floxies in the same position. So I guess
Yep.
anything you could explain on that would be wonderful.
Well, do you like the concept of the perfect storm? The Achilles, in every study, has failed regeneratively. And every single time I see a study come out on the Achilles, I contact the people who did the study and say, did you do this? Did you do this? Did you do this? Did you do this? Because there's the little known ones are, the Achilles is oftentimes a surrogate for radiculopathy or nerve impingement at the lumbar spine. So if you have disc or arthritic problems and they're impinging on your S1 nerve root, and that S1 nerve root is dysfunctional, that's going to show up as Achilles or plantar fascia pain often. And that's in non-floxed individuals. So you go up to that part, plus you got the sympathetic nervous system up there, plus you got the peripheral nerves, the sciatic, tibial, and tibial nerves that affect the Achilles. And then you get really esoteric. Is the degeneration in the middle of the tendon? Is it where the tendon attaches to the bone? Are there calcifications? Is there adhesions between the bone, the calcaneus or the heel bone, and the tendon? And then the tendon itself is like this and has like a sheath that sits around it, a peritenon. And if you move the foot up and down, you can actually see whether or not it's sliding normally in that peritenon.
Okay.
And if there are adhesions around the tendon, no amount of work on that tendon is going to help that adhesion part of it. And you have to release the adhesions to get the tendon to actually be able to move correctly, because too much tension or too much compression on a tendon will create tendinosis. So even if you do the best regenerative agent inside of the tendon will continue to deteriorate because of the abnormal compression and tension on it.
So is that where things like shockwave therapy would come in to help with that?
Shockwave therapy helps more from the neurovascular side of the spectrum.
Okay.
I was trained in a long time ago. I let Dr. Nash do it now, but it's very, very helpful for calming the nerves down, actually. And while I'm doing the regenerative agents, then it keeps that fight or flight nervous system from going too crazy. So this is the way I approach all these areas of the body, and it's because of the hundreds and hundreds and hundreds of patients that I've worked on where I failed somewhere. Sure. And failures keep me up at night. I like to sleep. So I have all these, really elaborate things that I do with people because I can and I choose to. I only do procedures on like 7 people a month so that I can have that much one-on-one time, so that much contemplative time for them.
And I think that's why a lot of Floxies hold you, or a lot of chronic pain patients hold you in high regard, because we know the time that you take, the expertise that goes into this, the training, and all the work that you put into it. So I know on behalf of many Floxies, we thank you for that, because not many doctors want to try to understand us and the pain that we go through. And it can be a lonely journey, that's for sure. So and then Peng, is there anything else that you would like to discuss, talk about, anything before I let you go?
It all starts here.
Yep.
And then really just encourage folks to see this as a, some of the things that, some of the trials and tribulations that we're currently going through, try to see them as opportunities for personal growth. It is a test of, can you overcome this? And try to find strength. This is it's hard for me to try to find words for this, but it really is about really using this as fuel to look deep within and try to find ways to grow and reconnect with other people.
Great, I love that. And Dr. Hanson, any last words for let you
Yeah,
get?
I got two things, Chris.
Go ahead.
I'll limit myself to two. How does that
No,
sound?
go ahead. I mean, you guys can talk. I just don't want to take up too much of your time.
In the spirit of what I said earlier, where you can't fight or you can't lose, you can't win an internal civil war.
Mm-hmm.
That's in the mind too, and this is gonna make people a little bit concerned that I'm saying this, and it might ruffle some feathers, but I'm gonna tell you this: when you have experienced something in your life that has changed you, be it fluoroquinolone toxicity, be it an accident, an injury, a medical mistake, a surgery, whatever. Once that's happened, it's now part of you. You can't turn back the clock.
Definitely.
And hating or being angry at what happened to you, the missteps, the doctor, the system, the FDA, whoever, is only sapping away energy from what you could otherwise be using to heal. And the end result of that line of thinking is you have to love the fact that this happened to you, because that's loving part of yourself. And that's a big, big, big leap for a lot of people to take. I know it is. But if you truly want to heal, you can't just have this thing like as your ugly child inside of you, that you hate when you want to hate it and love everything else about yourself. You can't do it. You have to love that this happened to you. And I will tell you, honest to God, everyone who's gone down this route, including myself, I had a seizure condition for 20 years and a brain tumor. If you get to the point that you love every part of yourself, including these what seem like bad things that happen to you, you will become a new person. You will have new perspectives, new thoughts, new abilities, new ways to connect with people that you never did. And you're never going to be what you once were, but honestly, you don't want to be. Because what you have in front of you and what's coming to you is much better than you could ever imagined. It's different.
Yeah.
It's just, but it's better.
And that is a very difficult concept, because you look and you say, like, for myself, I was, I had a sports business, I was coaching kids, and then overnight that was taken from me. I've been suffering for a decade, and this last hit in May of 2019, I almost died. I'm not going to sugarcoat it. I went from, overnight to in a wheelchair, to losing so much weight, to, I didn't sleep for 3.5 weeks straight. I was getting 15 minutes a night. I couldn't. So, and I had two options, and that was, one, I'm going to get up and fight with everything I have, or let this kill me. Right. And I started this group, and it's a struggle, and I hope, and I know that you guys know this, but it is like we're not creating any of this pain. Like, it is real pain that we never, and we have our doctors, we have neurologists tell us sometimes it's in our heads, it's in our minds, and those doctors can go to hell. No, but it's a daily struggle. So I think, as long as, and I know you guys do a great job at this, is understanding that this pain is real. This circumstances in our lives forever changed us, but help us take that, like you said, that negative, and flip it to a positive? How can we help one another? How can we, spread the knowledge on this, which is a personal goal of mine, to make sure that no one else goes down this route. So, and having you guys both on here with your expertise and explaining these things to people, I think a majority more are going to listen to you guys than they will me. So I'm glad that you guys are preaching what this group is all about.
But it's what you're doing, Chris, when you look at this, man, from a divine purpose, like in many respects, by you taking this hit, you became a shepherd, my man. And that's love, bro.
Thank you.
I really, what you're doing here is providing service, and there's nothing but gratefulness and gratitude for what you are doing, man. And I love you, brother, for really doing this. I really appreciate what you're doing, because this is what you're doing in many respects is God's work, man. And again, or the divine work, man. And so keep plugging along, man. You're giving people hope. And
thank you so much, Peng. That means more than you know. I appreciate it.
I want everybody to understand, like, this is there are times in life, from a spiritual standpoint, I've been at this all my life, since I was a kid. I never knew, whether you realize it or not, you are on a spiritual path. Everyone, whether you realize or not, you are on a spiritual path. And once you recognize that you are on a path, you can choose to do things differently. And it's easier to hear me say it, but when you really dig deep and look inside, I've been doing meditation and spiritual practice since I was a kid, not even knowing that I've been doing it. But the more I begin to communicate or commune with the voices in my head, my consciousness, and I begin to defeat these inner demons, these inner temptations, these human functions, biological human functions that we have from day to day, as I begin to master myself, I begin to be worthy of receiving information from the divine and have those conversations. If those conversations that you are having internally are negative, learn how to observe them and let them go by. Those voices aren't serving you, and you are in control. You are the voice in your mind. You got to stop letting those negative voices control you. I really want to empower everybody, please. As a person who is an intuitive, and I see thoughts and I see emotions, all I see is suffering. And most of the suffering is unnecessary. So I really want to encourage folks to really, sorry, man, like, like, nothing but love, man, like, but there's a whole lot of unnecessary suffering going on, man. And where you start is with yourself. Don't point the finger at other people. Start with yourself. And so, and again, Chris, thank you. You really are doing divine work, my friend. Really appreciate this call. I really appreciate what you're doing, man.
Thank you so much, Peng. And thank you for pouring your heart out there. That is admirable.
Beautiful.
And something that, everybody can learn from, because, putting yourself out there is a risk. I know a fellow Floxy who was scared to do so. And, she's watched a few videos of people putting themselves out there, and she did that, and it changed around her whole healing journey. And she's in a place now that, I'm not going to name her by name. She can comment on this if she wants to, but was depressed, close to death, and now has about 90% of her life back. And she definitely did get treatment, and the treatment helped. But I think a lot of that too was the mindset aspect of the healing, because as we discussed, you can't heal without that journey being crossed. So no, thank you so much for that.
Yeah, and it's an unfortunate fate, but sometimes this is a divine calling, my friend, and I want you to see it as that. I'd really like to encourage you to see it that way. Yeah, awesome. I really do.
Well, thank you guys so much. We appreciate you. We love to have you anytime you're willing to jump on, create a post or whatever you guys want to share with the group. That would be wonderful. We'd be, more than grateful. Keep doing your divine work. Keep helping others heal. Nothing but love for you guys. And I hope to talk to you guys soon. and I'll leave the floor for how people can find you if they want to, call you, how they can get a hold of you guys if they want to become a patient, and I'll let you guys take the floor for that.
Okay. Chris, I'm going to say one more thing before I say what the address and phone number is, okay? What is synergy?
Are you asking me?
It's yeah, it was a rhetorical question.
Oh, yeah, that's what I thought.
1 + 1 = 11. Now, that's me, that's Peng. There's a physical therapist, there's a chiropractor, there's a second chiropractor, there's a personal trainer, there's a dietitian, there's functional medicine. I don't know how many 8 ones is, but that's a heck of a lot of synergy. When you walk into this place, you feel it as a palpable bubble of just being immersed in the potential for healing. And I'm going to say, honestly, you are immersed in love when you come here. And that's how people heal. You go from fear to love.
Yep.
Now, to get a hold of the clinic, the phone number is 612-800-5096, and we're orthocureclinic.com, ORTHOCURE clinic.com, and we're right next to the International Airport in Minneapolis, St. Paul.
That's awesome. That is great. So hopefully you guys reach out to Dr. Hanson, to Peng Her, and ask them any questions. Hopefully if you're struggling, you can go up there. They're not too far away from a lot of us in this group, so make the trip and change your life. So thank you guys so much for coming on. Stay safe. This is a crazy time that we're living in, so hopefully you and your families are staying safe and healing, and we'll talk to you guys soon. All right.
All right. Sounds great. Thanks, Chris.
Sounds good. Thanks, you, Chris.
Everybody.
Guys,
yeah, thank you, everybody.